Hello nurses, this is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing in the NCLEX. This is cardiac lecture number 34, infective tissue problems resulting in heart failure, from this sticky note found on Nursing KAMP and social media. And again, this is a pretty exhaustive concept because there's a lot to cover in this area. I'm going to take one piece at a time. The first will be the overview of what's going on. But they all result in heart failure. That's the biggest key. And it's to pave the way. All right, and what do I mean by that? Well, in the previous lecture, I talked about to pave the way for an MI. Well, anytime there's a problem with the heart, what you're looking at is tissue, for the T, tissue problems. And that's kind of what we're talking about with this one. This is outside the heart problems, like tamponade. P is a pumping problem, which we saw with CHF, right? So in CHF there was a problem with the pump. But we haven't got into cardiomyopathy versus dilated versus hypertrophic yet. That's another lecture a little bit later. And then A, we covered with CAD, arteries, right? In MI and angina. And then V for valves. Valves also are related to this tissue with endocarditis and myocarditis, and also with CHF. We saw that with valves. And then E is for electricity, which will be in the electricity lecture. We covered a little bit with MI, and but right now we're going to talk about tissue. And we're talking about infective tissue problems per se. And the biggest thing about this is that it's the tissue damage is on the actual heart. It's based on the location, whether it's the endocardium, the myocardium, or the pericardium. All conditions will have an inflammatory kind of process that results in unique kind of emboli that kind of presents itself throughout the body. So when looking at the heart and the structure, we have a sac around it, right? And that's called the pericardium. And that's where we have pericarditis, peri, outside the heart. And that pericarditis is usually P for procedures. If a patient had like a paracentesis, usually resulting into an infection. So pericarditis is usually a result of infection, and very specific for those patients. They kind of sit tripody, so they kind of sit forward like this, and they're at risk because the big risk is tamponade with these patients. We'll talk more about that when we get to each specifics. The other one is myocarditis. So myo, I always think of kind of myo muscle, right? So myo or middle. And that's the actual tissue. And that's very specific in the sense that myoviral tends to be the most specific for that. And it's because it affects the whole tissue. And we're talking about infective problems. You can't have bacterial problems that result from endocarditis into the myocardium. All right, and then the next one is endocarditis. Endocarditis is most specifically on the inside. So when you're looking at this section right here, the endocarditis. So it's all things, a lot of times it's usually stuff from the outside. And what I mean from that is like IV drug use outside, and it's introduced into the blood, and it kind of affects onto these valves, and it kind of causes problems with that. Other things too, like congenital disorders and stuff like that, could affect the endocarditis. But it's very specific. But the big key is that majority of them, when you're talking a patient has, it's either endocarditis, myocarditis, or pericarditis. For the NCLEX, they don't go really in depth with this. It's mainly a CHF problem. But these patients are very specific because they're going to have new onset murmurs. And that's specific. And the problem is whenever you have a new onset murmur, that's acute. It's acute because it's in a question and it's talking about a new onset. And when a new onset means you're hearing something new, you're hearing a swishing sound or a rub or something that's happening inside the heart. And when you listen to heart sounds, S1, S2, which we talked about in the previous lectures, so if you ever start to hear S3, S4, it's always acute. Okay, and it's about fluid or CHF. And that's the big key with this infective tissue, is that whenever there's a problem with infective tissue, it's about heart failure and the risks and the comorbidities that they can have from decreased cardiac output. So the cardiac output actually starts to get decreased, and cardiac output is 4, 2, 8, half. All right, that's about it. This is lecture number 34, and this was an overview of infective tissue problems. And I'll cover each one specifically in the next lecture. Okay, nurse on.